Okay, well, thank you and good afternoon. Another hot day, another hot week here in Ontario. And we're going to cover some numbers and some directions, some things concerning, some things reassuring, and how we're seeing the progress in stage 2, and as we continue to plan and anticipate for stage 3. So we've had, and we're going to comment on the numbers here, we have 36,348 confirmed cases thus far in Ontario since the onset of the COVID-19 back in January. Today it was an increase of 171 cases. And when I first saw that, I said, oh, that's rather perplexing, because we had been at 112, 118, well below 150 for a period of time, and that was concerning. And yet when I looked at the breakdown of the numbers, I said, well, okay, Toronto is only 27. That's really low. Peel is down to 28. A lot of the health units, 30 to 34, had 5 or fewer cases. 20 to 30 had no cases at all. When I looked at numbers, then you could see that in Windsor, Essex, they had 86 as compared to their 4 or 6 in the last few days. So this, as we looked at the data there, is mostly an accumulation of investigation on 2 or 3 farms that are contained. In that, 76 of those 86 are definitely farm workers. There could be others, including 9 cases that are under investigation. If you take that in mind, that means that nearly 80 or 86 of the 170 are from 1 or 2 outbreaks. That means the province, which I was hoping to see, as I said last week, we might have a day when we actually have less than 100 for the province. And in essence, in one way we do, but with in consideration of a very much sequestered outbreak, that put us well over. But as I said, over half those cases are on outbreak locations. So in a way, people are doing well, and we continue to see progression in a number of areas there. We see a lot more recoveries. In that, we have had another 172 recover. And that means 88%, or 31,000, nearly 32,000, 31,977 have recovered. The number in the hospitals are coming down, 123 at the moment. ICU is 31, minus 4, and ICU on ventilator, 23, down by 3. So again, metrics improving there. Still having some deaths in different settings. We had 3 more for a total of 2,703. And in our long-term care homes, we're down to 25, their data, down to 25 outbreaks. So that's down considerably from where we were before. They reported in their data accumulation of 11 deaths, so that doesn't match quite with our IFAS data, but that's due to changes in reporting. And in retirement homes, they stayed at 5 outbreaks, no deaths, no cases in residents, and 5 still residual ones in staff. So again, positive numbers and showing a good direction throughout, but we're still having outbreaks, as noted. Not in farms, we have some workplaces, and public health is on those. You've heard much about the nail salon in Kingston and how that was handled. We've had other investigations throughout where public health has stepped up in a proactive way and done comprehensive testing to locate cases and to contain that outbreak within that setting. As the deaths have been on our overall weekly trends, so the week of June 28th to July 4th, as I said, our counts continue to come down. As the number of cases in our over 80 and over 70, 60 age group go down quite low, the same number are occurring in our 20 to 39s and some of our 39 to 50-year-olds, so that percentage-wise they're making up a more large proportion of the cases we are seeing in the last week period. The data with exposures, 63% now tend to be associated with contacts and outbreaks, and that's quite different than it was before. There still is some travel, not much, and that means 25% have no epi-link, so that's down from where we used to be in the 42% range, so it's progressing well. Testing continues to be robust as usual. We had over the weekend the drop of Monday and Tuesday, which represents Saturday and Sunday, and then to Wednesday we had lower numbers, but today we're back up to 26,326 tests and a positivity rate of 0.9%. And that's important to note that even with that large number, on a province-wide basis, we had, outside of the outbreak, less than 100 cases reported. So all moving in the right direction, as I'd hope to see us coming down. I'd like to see us continue to have some days reported under 100, and we want to see that so-called transmission rate, the R naught or RT as people call it, down lower. We're running at about 0.9, 0.8 province-wide, some areas higher and lower, depending on outbreaks and cases, as I noted above. So those are the general messages for now. And they're still asking people to, as you're out and about, more and more rules in different places about requirement of masking, especially in some transit locations, as well as in indoor public spaces. And I encourage that. I am doing the same. And we need to be, I would say, consistent in that and vigilant. And not just from doing it, but also it continues that message in our mind. We still have to be cautious. And by keeping doing that, we're seeing, as Ontarians are doing it, they're bringing the numbers down, and we would like to get that down to really low levels, especially as we move into stage 3, and we'd like to get into that progression further as we look at how we might deal with a potential modeler's view of a third wave or second wave, and how we might even reduce that. Ideally, I'd like to eliminate it, but it depends on the concerted effort by everybody, and with reducing risk factors for importation as much as possible. So that's the updates from my side with the data and numbers. So over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question.
First question comes from Antonella Artuso from the Toronto Sun. Please go ahead.
Thank you. Hello. I wanted to ask you, are there any activities that you believe we won't be able to get back to safely until there's a vaccine? I'm thinking of things like concerts and attending sporting events. Or do you think other measures like mandatory masking might allow that to go ahead?
It's a good question. I know our public health measures team is looking at these different venues and looking at the risk of exposure to large numbers of people in close congregate settings for periods of time, especially with a lot of aerosolizing, as you imagine, at a concert or at a sports venue with people yelling and cheering. There is a lot of droplet spread and sharing. So they are certainly high-risk settings, especially because you can't tell who's actually going to buy the ticket and seat next to you in the normal behavior. So we'd have to be persuaded there's some way you could do it with separation, and that may be such that in some venues, one, they physically can't do it, and second, they would find it fiscally untenable because they couldn't actually produce the profit margin they're looking for. So we're open to some ideas, but as you've noted, as you allude to there, those are certainly high-risk events that we have very little control over, that we'd have to be well informed of how that might be undertaken in a safe and ongoing public health measures method as we go even into the fall.
Follow-up?
Thank you. There has been some pressure from the United States in some quarters to reopen the border for non-essential travel. I know that the border is a federal responsibility, but what advice would you give the Premier in terms of that border? Given what's happening in the United States, do you think this is something that might be safely done even before there's a vaccine, or do you think that given those numbers we'll have to wait until there is a vaccine before that border can reopen to anything other than essential travel?
My advice, especially unfortunately with what's happening and the escalating number of cases south of the border, is very concerning. And I do feel that we should be very careful on that. I understand there's essential, and there's people are in, I would say, essential relationship issues that they would like to, I think the Prime Minister would like to rectify. So I believe the Premier and others will be having those discussions. I get a sense from overall there's not a lot of eagerness to open up, because that's really what got us into trouble back in March. And we have to be very careful. And if we're going to do any more travel allowance, we're going to have a very rigorous screening and monitoring process in place, because you saw some problems already just recently in PEI in Nova Scotia that was related to that. So it's a wake-up call to say you can't be too careful in this matter, and we have to be planning for a very, I would say, cautious and well-monitored opening, if at all, in various areas dealing with needs. I wouldn't say carte blanche, but I think we have to be cautious, and I think my fellow CMOHs from across the country are of the same position.
Next question.
Canadian Press, please go ahead.
Good afternoon, Dr. Williams. Wanted to ask you about some comments that the Minister of Education made this afternoon during the briefing with the Premier. He indicated that the province would prefer students return to in-class learning in the fall. And he suggested that this is contingent on a lot of different things, but also some input from you. And I'm wondering what you would like to see put in place that would ensure the safe return of students to class in September.
So when we talked last on some aspects 3 or 4 weeks ago, the epidemiology is at a certain level. It's at a different level now. What would it be like in late August? I'd like to think it'd be even better, but I have to wait to see that. I think the direction that you alluded to there, I'd have to have that further discussions with the Deputy Minister and staff, and we have had those discussions and we'll continue to have those to say what can we do that would allow different scenarios and aspects to be undertaken in the education system. We know there's the pressure and issues around working parents, both with schooling and with daycare. And if you did it, in what way could you do it in a way that was in a way containable and still allowed that, as well as keeping parents informed and satisfied that the precautions and checks and balances were in place to protect not only their children, but since some of them can actually carry it and be very minimal symptoms, they could bring it back into the household and infect the adults and perhaps some other vulnerable people in the household or family connections. So we continue to have those discussions to look at that correct balance, knowing the need, the social aspects, the connectivity side, the work things as you open up to stage 3, and allowing parents to go to work where they had structured that around children attending school and daycare. And so I think these are very critical questions that we want to have some more fulsome discussions over the next number of weeks to see if we can come up with ideas and thoughts around that to, if we're going to go with one scenario or different scenarios, how would that be done in such a way that we would be convinced it was containable and safe, and at the same time reassure parents, students and teachers that it is also safe and any issues could be handled in a very timely and effective way to avoid any wider impacts if there was a problem. So that's where we're going to have those discussions. We need to have those discussions, and I'm sure the Minister will be giving some updates when we've had some conclusions on the matter.
Follow-up?
On another subject, Dr. Williams, I wanted to ask you about the farm outbreaks in Windsor, Essex. The testing continues to reveal, as you mentioned earlier, more cases of agri-food workers testing positive for COVID-19. I'm wondering if you can provide any further update on the province's efforts down in the region to isolate the workers and continue to ramp up the testing there.
Well, there's a lot of work going on, I can tell you, working with the Deputy Minister in the Ontario Ministry of Agricultural, Food and Rural Affairs, as well as with our senior levels of government, with our other ministries, Labour and SolGen, and working at a coordinated effort. So we have the public health response, we have the ongoing Ontario health testing and monitoring, we have the need for isolation, the working with the local authorities there, municipal and public health, with an IMS structure we talk about that actually brings in wider sector groups. They're looking at holding hotel rooms, looking at the needs of people there who are isolated for a period of time, looking at their physical needs, their food needs, their psychological needs, their other personal needs in that aspect, so they can contain and maintain that isolation and get them cleared and back into the work milieu, not back into an infectious state, but back into one, and try and keep enough people who don't need to be isolated, who are cleared, to be on the job to keep the solvency and the operation of these fairly large enterprises up and running until the rest of the workers can return and do that. So there's a lot of different players involved here, and all the concerted effort, as the Premier always talks about, to one foremost, protect the health and safety of all the workers, including our migrant farm workers and our transitory temporary workers from Ontario and around the area, and at the same time to try and look at maintaining, put in place prevention and health incurring processes to improve the health of the workers, and also to see if we can maintain the solvency and the functionality of the farms as they are on very tight timelines, and the clock keeps ticking on them, so they have to keep the work going. So it's a fine balance, but many parts involved, much high investment, much interest from the Premier right down on to make sure it goes well in Ontario. And right now, while we're focused on Windsor-Essex, we will make sure we're going to look at other places as well to ensure the safety throughout Ontario of our migrant farm working community.
Next question.
Next question comes from Katrina Clark from the Hamilton Spectator. Please go ahead.
Thanks for taking my question. In Hamilton, we're hearing from dozens of people who are waiting up to 12 days or more for their negative test results, and that's often in cases where they need the test to be able to visit someone in long-term care. Hamilton Public Health has said people waiting for a negative test will be waiting up to 10 days, if not longer. But locally, Public Health doesn't know what's causing the delays, and they say that they're working with the Ministry of Health and with Ontario Health to figure out what the problem is, and it does appear to be a Hamilton-specific issue. So I'm just wondering if your office is aware of this issue and if anything is being done to resolve it.
I had mentioned to me, we've had other individuals, some have communicated to us about long delays. Ontario Health, who monitors the overall system, still reports that the overall function on the average is within the proper timelines. At the same time, when there's cases like that, especially there's a number of them, it's 12 days is too long. And if there are systemic problems, we need to address those. If it's in the Hamilton area, we'd have to look at what are the barriers in that matter and how can we handle that. I guess the good news for some people is that if you get a call right away, it may be more that it's a positive test because they want to move on that fairly quickly, which is their priority. The negative tests, waiting that long, I find that still unacceptable, and I hope they can work and address that. And often it's time of the last lesson transfer, the result going back, it ends in someone's file, it's stuck on a desk, the person's off for 3 or 4 days vacation, they didn't get back to call the person. While those are good excuses, there should be ways to handle that, and so that doesn't occur. So if that's happening on a large amount or a fair amount, a significant amount, I think system issues have to be addressed and see if they can be amended.
Follow up.
Thank you. And then also relating to that first question, I'm wondering, do these test result delays not somewhat render the requirement of having to have a negative test to visit someone in a long-term care home a bit useless, just considering that people are going about their business for up to 14 days before even getting that test result back, and then they're rushing to go and get that appointment in maybe the day that they have left. So would your office consider recommending eliminating or somehow changing that negative test requirement for visits to long-term care?
Well, I understand that there's a continuum always from our long-term care ministry and as well as our IMS group looking at that as the outbreaks are coming down. They're continually trying to address how to allow as much flexibility in there. And so I think whether some requirements now, they could be altering and changing those in the next period of time as they watch the overall, see what the community spread of cases are and what the risks are in respective jurisdictions. So I know that they're addressing that, and I'm waiting to hear any updates from them if they're going to alter visitation requirements or staff testing accordingly as they continue to say they will update and review and will modify as they see it is safe to do so for the protection of the long-term care residents and to keep the downward trend in outbreaks going right down to zero, what we'd like, and are very low, and no deaths and no staff and resident cases is what we'd like to see. So they're still trying to drive down to that level. So we'll have to wait for updates from them.
Next question.
Next question comes from Ashley Legasic from News Talk 1010. Please go ahead. Pardon me, your next question is now from Chris Ensing from CBC Windsor. Please go ahead.
Hi there, doctor. Just a question about farm testing. Out here locally, the hospital in Leamington said that the first pilot project for on-farm testing was June 20th. And as of Monday, we understand that 19 farms have been tested with a handful, 5 more scheduled to be tested. That's out of, I believe, 176 in the region. The Leamington mayor, Hilda McDonald, said that she doesn't believe that this is happening quick enough. Any understanding on how long it's going to take to test these farm workers?
Yeah, we're trying to move on it as expeditiously as we can, knowing that what we ran into is we found some large outbreaks in some of these institutions. When you find the large outbreaks, you have to assertively address that. And we ran into some logistic questions around isolation facilities. You got to amend those quickly and get that in place, because if you identify more and more and more, you need to have that available and those resources that would handle that. The assumption going in is that we're probably doing a lot of these places that didn't have, as far as we knew, much activity. And we did some 90 and all negative, another one. But then we did some, and all of a sudden, surprisingly, you get 28 positive that you didn't know were going to occur. And sometimes you get up to 180 and 190. So these are big numbers to deal with, and you have to offer the whole program. You can't say, well, just go ahead and keep testing and leave people basically hanging on stuff. You have to keep addressing those needs and complete the task of the outbreak management at the same time. So we want to do the testing as quick as we can, but if we're going to do it, we want to do the handling of the outbreak as quality, as effectively and efficiently, and in concert with the local authorities as well as with the owners and the workers, so that they're all on the same page and understanding what's going on. So we're getting better at it. We're learning more as we go about the different nuances of it. And so our task is to do it comprehensively, but more importantly, do it well, such that we're not just quickly looking at it. We're solving problems on an ongoing basis in order to establish a healthy workforce in that area.
And again, on the asymptomatic decision that was made previously, I do believe the most recent is that was guidance for smaller farms, not larger outbreaks. Are you aware of any asymptomatic workers that have tested positive that have been asked to return to work?
So asymptomatic workers who have tested positive, they have allowed to go back to work. In the example we're doing now is if they remain asymptomatic in the 10 days from the time when they had their positive test. So they're in cohorted away, and a number of the ones one of the large ones, as they complete that 10-day period, nearly 100 and many out of that number have all gone back in the regular workforce, because they now have evidence that they have had an infection in the past. It's not infectious now, and they perhaps, when we have serology in that, will have immunity, and so are not a hazard to themselves or to the other workers around. So that is occurring. If you're talking about asymptomatic workers who tested positive, they're separated out and cohorted away from the rest of the workers, and any ones who are in close contact with those asymptomatic cases that are negative are pulled out and put into hotel isolation to be monitored 14 days. And unfortunately, we've seen a few of those become positive and symptomatic, which was our concern. But others who have not any contact with that group of positive asymptomatic workers are cohorted away, working separately and kept separately. But we continue to monitor the situation to see that system is working as robustly and correctly as it should.
Next question, and this will be the last question.
The last question is from Ashley Legasic from News Talk 1010. Please go ahead.
Hi there. Can you hear me now?
Thank you.
Hello?
Yes, we can hear you.
Okay, thank you. Hi, Dr. Williams. I want to discuss stage 3. Most public health regions in the province are reporting 0 or at least fewer than 5 new daily COVID-19 cases. The Premier has spoken about a regional approach to stage 3. So what's the holdup for communities outside of Toronto, Peel, York, and Windsor-Essex? And can you give a timeline on when we can actually start seeing some areas move into stage 3?
So as I mentioned earlier at the outset, we are looking at the data. It's looking very positive. Same numbers that you quoted, I put in the daily numbers. And we're continuing to make recommendations up, as well as with the cabinet committees to the cabinet for consideration. And they are continually right now working and looking at that. And so if there's going to be some announcement, of course, that would come from the Premier. And when that timing would be. And so we'll have to stay tuned to that. The actual timing, is there going to be a regional approach in different aspects? These are all components that have to be approved through the emergency powers with the cabinet. So it has to wait for that approval process before I can announce anything on that matter. And that would usually be on the heels of the Premier, as he has done in the past, making those announcements. So we'll have to wait for that.
Follow-up, this is the last question.
Thank you. And the Premier also said today he couldn't provide a list of places that would be allowed to reopen in stage 3 because the ultimate approval would come down to health officials. So I know you just touched on it briefly, but do you have a list? And if so, what would that include?
Well, all I know is that we have, there is a large amount of things on the table being considered. Our health side is that maintaining the safety aspects in there. What is the planning for that? So can we continue our aspect of the public health measures, the 6 foot, 2 meter distancing, the masking in public places on different settings, hand hygiene, stay home if you're sick, get tested. And so then in that whole cadre of different ones, and I would be in air to start even mentioning them because that's all part of cabinet approval. In that regard, and so I would not want to comment because I would never get them all right because it's quite extensive, all the things that are being considered. So when that comes forward in the announcement, that documentation material would obviously be made known, and the Premier would allude to that, and then materials would follow suit from other cabinet ministers such as the Minister of Finance.
Thanks, everyone.